Welcome back. Men are growing out their facial hair this November for a cause. It's called Movember movement, and it puts a spotlight on men's health, prostate cancer, and testicular cancer. Dr. Jason Hafron with the Michigan Institute of Urology joins us now to share more about this movement. Thanks so much for being on the show with us today.
Thank you for having me. I really appreciate it.
Yeah, of course. Let's start by talking a bit about this men's health initiative this November. What is it? How can people get involved?
Yeah, No Shave November or Movember has been a men's health movement over the years that is really designed to raise awareness and raise funding specifically for prostate cancer and testicular cancer.
Can you talk about how common prostate cancer is in men and maybe some of the less common symptoms to look out for?
Yeah, unfortunately, prostate cancer is the most common cancer in the United States for men. It's the second leading cause of cancer death in U.S. men. 1 out of 8 men will develop prostate cancer, and prostate cancer is diagnosed in a man in this country every 2 minutes. Unfortunately, there is not symptoms that patients will notice, but typically in the U.S., the prostate cancer will be picked up with a simple blood test called a PSA blood test.
Okay. Is there any genetic component to prostate cancer? Something that if it's in your family history?
Yeah, prostate cancer unfortunately does run in families. We'll see this nesting of prostate cancer in families. It also is associated with some genetic mutations within patients. So definitely, if you have a history of prostate cancer in your family, or if you're African American descent, it's important that you start your PSA testing from the ages of 45 on to 50. And if you have no real significant risk factors, you should start PSA testing in your 50s all the way to your 70s.
Okay, such important information there about when to start screening. Can you also add maybe how often to screen? How often should men test?
Yeah, testing should be almost on an annual basis, depending on the risk factors. Again, the PSA test is a simple blood test that patients can talk to with their urologist or their primary care physician.
Okay, you talked about if you have a family history. Also, I believe I heard you say if you're African American. Are there any other factors that can elevate prostate cancer?
Those are the common ones, and that's what we see on a day-to-day basis. I think the message and why we do No Shave November and Movember is to get men to go get tested. PSA testing is really the only way we can find prostate cancer, and fortunately, if it's caught early, patients do very well. With that being said, we've evolved, especially in our practice in Michigan at the Michigan Institute of Urology, we've evolved to new tests that combine PSA testing to improve the accuracy and the sensitivity. One of the tests that we're using now is a new test called the ISO-PSA test that looks at PSA proteins, not just the PSA test level itself. With this test, the ISO-PSA, we are able to diagnose prostate cancer more accurately and identify more aggressive disease in earlier stages.
What is this? What is this like for you? Getting to work with these patients. You know, for some people, this diagnosis can be the most difficult day of their life or of a loved one's life. Is it rewarding as we have these advancements in technology?
Yeah, people always ask, like, it must be sad to take care of cancer, but I think it's the opposite. Fortunately, when we diagnose it early, we can cure these patients. Patients can do very well. It's just sad when patients don't get tested, they don't go see their doctor, they're missing out, or their doctor sometimes doesn't even order the test. That's the most upsetting thing when you see patients have disease that could be prevented. But overall, I enjoy what I do. It's fun working with men and their partners and letting them get better, healthier, and lead full lives.
Well, you're certainly spreading that awareness this afternoon as part of the larger Movember movement. Thank you so much for being on with us. We appreciate it.
Thank you.